welcome back to Heart and Techie. So in this video we are going to discuss about the waveforms. So the basic of the ECG, what is meant by the P waves, and what is Q wave, what is R wave, what is S and what is T waves, and what is the duration of the P waves, how this P wave is occurring in the ECG, and what is the time and duration of this P wave and all. So these are the topics which we are covering in our video. It's an introduction video for the beginners, so I'm just going to describe in this video mainly about the P waves. Okay, the first part will be about the P waves. So this is a representation of the normal ECG waveforms. So we can see this is the first wave will be P wave, then coming QRS complex, then T wave, and T wave usually won't be visible in the normal ECG. Okay, so what actually this P wave represents? Okay, so when we are taking the P waves, so we can see this is the atria of our heart and this will be ventricles. So what this P wave actually represents? So this P wave actually represents the atrial depolarization. Atrial depolarization means this heart is contracting. Okay, when the atrium is contracting, so when this atrium is contracting, this P wave, this first positive deflection is coming in the ECG. Okay, so it mainly representing the atrial depolarization. So depolarization means contraction. Okay, contracting. Okay, so next we are going to see what is the duration of the P waves. So normal duration of the P wave will be less than 0.12 second or 120 milliseconds. Duration means for how long this P wave is seen in the ECG. So this time or duration is 120 millisecond. Then next, what is the amplitude of the P waves? So amplitude means the height. Okay, so if this is the P wave means this height is known as the amplitude. So the amplitude of the P waves will be less than 2.5 millisecond in the limb leads and less than 2.5 in the limb leads and less than 1.5 in the chest leads. So why we are separately telling this limb and chest leads, I'll explain now. Okay, so first of all, I'm just revising all. So the P wave is the first positive deflection which we can see in the ECG. So it represents heart atrial contraction and the duration is 120 millisecond. The height or the amplitude will be less than 2.5 in the limb leads and less than 1.5 in the chest leads. So the P waves can be very well visualized in the two leads, lead 2 and V1 from the ECG. So as I told you, the P waves representing the atrial contraction. So when this atria are becoming contracting, so we can see the P wave in the surface of the ECG. Okay, so if we want to interpret a P wave as very clear, we have to see the P waves in mainly two leads, one in the lead 2 and another in the V1. So in the lead 2, the P wave having a positive deflection we can see as normal waveforms, and in V1 when we are, so in the next time when you are analyzing a ECG, just be focusing on the P waves more. So you can see there will be like two deflections we can see from the V1. So one is a positive deflection and another one is a negative deflection. So why it is differing? And as I told you, the P is representing atrial contracting. So there is right atrium and left atrium. So if the P wave is representing the atrial contraction means which part of the P wave representing right atrium? So from which part we are getting the left atrium? So that I'm going to explain you next. So when we are taking lead 2 as reference, so this is the baseline. So if I am partitioning And if I am cutting the P waves into two parts, this first portion represent right atrium and second portion will be representing left atrium. Okay, so if the right atrium is contracting first compared to left atrium, there will be some delay in between the atrium. So right is contracting first, so the first portion represent will be like this, will be like the deflection from the right atrium, and so the second half represents the contraction of the left atrium, electrical signals which is arising from the left atrium. So when we are taking the V1, so this is the baseline, so this represent right atrium and this represent the left atrium. Okay, so whatever the abnormalities, if example, if there is a right atrial enlargement, so the first portion of this right lead to first portion of this PV is having different morphology than normal. If there is a left atrial enlargement, this means this portion will have different morphology, so it differs, so that I will explain in you in the next videos. So here we are mainly going to explain about the Q waves. So what is meant by Q waves? So Q wave is a part of QRS complex. So this is the Q wave, this is the R, this is the S. So first of all, I'll tell you one thing. This Q waves you cannot able to see in the normal ECG as usual. Okay, usually we cannot able to see this Q wave because the deflections will be very small. Okay, the Q wave will be represent as a very small waveform. Okay, so mainly what this Q wave is indicating. So QRS complex means why this QRS complex is appearing. It appears due to the contraction of this ventricle. So if the ventricle is contracting in according to pump the blood, so if the ventricle is contracting, that time this QRS complex appears. So Q wave is the first portion. So the ventricle won't be contracting from the side to the top. It does not like that. The deflection will be the contraction will be start at the area of the interventricular septum. So what is meant by interventricular septum? So interventricular septum is the septum or a small muscle layer which separating two ventricles, not a small muscle layer, it is the muscular layer which separating the ventricle. So first when the ventricle is contracting, this contraction will be originating first in the interventricular septum. So first what happened, this septum will move towards the left, then it will move towards the right. So when the ventricle is contracting, we will think so if this is the ventricle, the heart is contracting like this. It does not like that. So it's kind of, there is a different symmetry. So the septum also moving for the ventricular contraction. So this septum moves from the left to right in the beginning as a part of the cardiac cycle. So what happens, this Q wave is seen in the ECG. So because of this septal contraction or the septal movement, this Q waves we can see in the ECG. So at what cases I told you, like Q waves we cannot able to see all the time from the ECG. Why? Usually the Q waves represent like myocardial injury. This Q waves will be visible as abnormal as normally in the ECG. So Q wave represent mainly cell death or the cell injury. So if the Q wave is present, if its length, if it is more than 1 mm, if it is more than 1 mm, it is abnormal. Okay, so if it is less than 1 mm, it is considered as normal Q waves. So there are two type of Q waves. One is physiological Q wave and another one is pathological Q wave. So physiological Q wave means the Q waves which is having less than 1 mm will be like physiological Q waves that can be considered as normal. So if it is more than 1 mm, it is considered as pathological. So here you can see I draw the Q wave as wide. Usually the Q waves we cannot able to see like this only we can see in the normal ECG as a very small minute deflection. So if it is very deep, if the Q wave is very deep, and so when we are taking a QRS complex, so this is a normal QRS complex considered. So if this Q waves is very large, okay, if it almost occupying 25% of the QRS complex, means it is considered as abnormal. Same like the P waves, in some leads we can see the Q waves if it is present very clear in some leads. So that leads will be like mostly in the lateral leads. So in lead 1, AVL, and in the chest leads from V5 to V6. So mostly in the lateral leads, this Q waves we can see more clearly. Next, what is meant by the R wave? R wave is this positive deflection which is seen in the QRS complex known as the R wave. Okay, what this R wave actually represent? R wave actually represent the early ventricle contraction. So when the ventricle is contracting, the first phase I told you, the QS represent this septum's deviation, the septal contraction from the left to the right side. That represent the Q waves. This R wave represent the early depolarization or early contraction of these ventricles. So there will be like R wave, some R wave abnormalities are there. So why this R wave abnormalities is occurring, that we can discuss in the upcoming videos. Okay, so there will be like some particular pattern of the R wave we can see from the lead limb leads to the chest leads. That is called as R wave progression, like how this R wave morphology is varying in lead to lead. So I told you, as I told you, this P wave and Q wave we can specifically see in some leads. The R wave is not like that. In every leads, including the limb and chest leads, we can mainly see the R wave in different fashion. So that is known as R wave progression. Okay, how the R wave is progressing. So this is an important part in the ECG, so that we will discuss in the upcoming videos. So what is meant by the S wave? S wave occurs due to the late ventricular contraction. So this negative deflection we can see in this ECG is this S wave. So what happened here? So ventricle is contracting, the last stage of the ventricular contraction represent this S wave. Okay, next we are going to discuss about this T wave. So when the ventricle is contracting, so definitely after the contraction the ventricle should relax to, which allows the refilling of the blood. So the ventricular relaxation, so after the contraction, so once the ventricle got contracts, it should be coming back to in normal size, and it should be relaxed to get blood from the atria to ventricle. So if the ventricle is dilating or ventricle is relaxing, which allows the refilling of the blood, so that represent this T wave. So this T wave will be like this, as upright in the all leads except lead AVR and the lead V1. Okay, and in other leads the P waves will be like upright. In AVR and V1, T waves will be inverted, and the duration will be less than 5 mm in the limb leads and less than 10 mm in the chest leads.